The James Show Podcast.
There's a lot of lessons to be learned from the shutdown, but it sparked a pretty interesting debate here on healthcare that's not even health related. This is an economics question. And I almost want to say, after the first few callers here, I don't even want to talk to you. If you've never read a book on economics, you probably shouldn't call in it or have a strong opinion on this. But I don't want to be like a gatekeeper here. But how about this? I strongly recommend, before you have a strong opinion on this, go read Henry Hazlitt's Economics in One Lesson or Thomas Sowell's Basic Economics. They're quite similar in their economic philosophy, and you'll know exactly where I'm coming from, and I won't have to go back and start at the kindergarten drawing board of economics every time we have one of these discussions. And if you're thinking, well, Parker, I'm not going to go out and buy a book. All right, listen, the audiobook's on YouTube. Just go listen to it for free before we have these discussions. Because we have the Democrats who want to keep the Obamacare subsidies going. We have the Republicans who want to end them, but that's about it. But we don't have anybody up there saying, hey, how about we repeal Obamacare? And when I say nobody, like Mike Lee tweeted that. I believe Rand Paul and Thomas Massie have tweeted that. But there's no bill to repeal Obamacare. Remember, that was the coolest thing in the world. When a Democrat was in power, they had like 15 votes on repealing Obamacare. Well, what about now? I would like to go way beyond that. But now we have Republicans saying, oh, I don't know, man. I don't know if we can end these Obamacare subsidies. Marjorie Taylor Greene.
And I'm not going to stand there and just keep talking the talking points when my own adult children can hardly afford health insurance premiums, when everyone in my district, it's the number one issue that I hear about day in and day out, not just people on the ACA, but people that have private insurance as well. And I think it's something that we have to talk about.
Well, look, if health insurance wasn't fixed by Obamacare, then let's talk about the idea of just the first step we should take isn't ending the subsidies. It should be ending the whole damn program. I don't know what is this rush to spend more money on healthcare. The more money we've spent, we haven't gotten better results. In fact, we've gotten worse results. We spend more money per capita on healthcare than any other country on the planet. Now, a lot of our outcomes are better, but it's not better what we have now compared to what we had before Obamacare here within America. And that's not like the beginning of the discussion. See, this is what's so just absolutely irritating about the clean continuing resolution. I don't want a clean continuing resolution. I want a resolution that cuts some of this dumb stuff out and makes our life better, not kicking the can, not continuing failed policies, actually making some changes. Because I don't think we need more health insurance. I don't think we need more programs. I think the problem is we have health insurance for too much stuff. Health insurance should only cover catastrophic things, like when expense is $100,000 or something crazy like that. But now I got to show my card every time I go in for the sniffles, or every time my kid wants to get some blood work done, or every time the health insurance company has to be involved in it. That's what's driving up the cost. Imagine how much more expensive your car insurance would be if it had to cover your gas and oil changes. Right. Are we thinking about that now? No, we're not even having that discussion in the court of public opinion. And I don't know what's so hard about this. Repeal all of this. And people say, well, James, without Medicare, old people won't be able to afford their health care. They can't afford it now. Look, Medicare doesn't cover everything. It has premiums. It has co-pays. If you're a couple that is 65 right now, between now and the time you die, y'all are going to spend, on average, more than $300,000 on health care out of pocket. That's above and beyond Medicare and whatever else insurance you can cobble together. That's not even counting long-term care, like if you get stuck in a home. The number one driver of bankruptcy in retirement is uncovered health care costs. So yeah, repealing Medicare, would you even notice the difference? It would probably. I know this is so hard for people to fathom because you don't remember a world. I wasn't even born in the world before Medicare. But here we are. Jim in Carrollton, you're on WBAP.
Hey, James. I think you might have moved on from where I was going to talk about, and that was the illegal alien and the cost. One of the issues that I see is that when you talk, there's two aspects. One is emergency care, which you talked extensively about the cost of, but that's not going to go away. There's laws that say that if somebody walks in, you have to take care of them.
Hang on, let me stop. That can go away. There's nothing wrong with that going away, and there's nothing inhumane about it going away. If an illegal immigrant goes into an emergency room and gets health care, they should get the bill. Not Jim in Carrollton, not James sitting over here by the American Airlines Center, not the American taxpayer, whoever gets the service. Just like if I went to the emergency room, I couldn't slough off my bill on everybody else. I couldn't go find random people in Mexico and be like, hey, this is your problem. Anyway, so I already disagree. Go ahead.
My daughter works in an emergency room, and from a standpoint of a society, if somebody walks in there and needs care, we're not going to ask them for an insurance card and put them out on the front. So
I agree with that. No, okay, again, no one is saying deny them health care treatment. No one is saying let them die. No one's saying kicking them out and just let them die in the gutter in front of the hospital. I don't know anybody that's proposing that. What is so hard about give them care and then give them the bill for the care that they just got?
You can. They won't pay it. They don't have the money to pay it.
Oh, okay. Well, can I do that?
Yeah, you can, because it happens all the time.
Cool. So
if you don't have insurance, they're going to try to bill you, and then they'll just have to give up and it happens all the time. People come. My daughter works in an emergency room. People come in there all the time, and they need this and need that, and they don't have insurance, and they can't pay, so they give them a bill, and that's the last they see of it.
Sure. All right. I'll just. Why don't we all do that for our health care then?
Well, because we're a society, and most of us are trying to keep things together. But
no, look. Here's the truth, Jim. Because I have listen. I'm sorry to keep interrupting here, but if you're building on sand, I want to build on concrete. Listen, I have health care bills out the wazoo. My kid had kidney failure 2 years ago. It was a $42,000 helicopter ride. I don't know if I'm ever going to pay this off, but I'm going to try because it's the right thing to do. And if I don't, I will face negative consequences. They will come after me. They'll garnish my paycheck. If I have to declare bankruptcy, that's going to ruin me financially for 7 years. I'll be untouchable basically for loans and whatnot. So why don't they have to live under the same regime that I live under, Jim? That's all I'm asking. I'm asking they'd be treated the same way I'm being treated.
And I'm in total agreement with you that they should. And not only that, if they are illegally here and they get Medicare, okay, we make sure that you're not dying, and then you're headed for the border. I mean, I agree with you. The thing about this shutdown and the Democrats, what they're doing is convoluting that emergency room care with coverage. Yeah. I think you touched on it, but the real thing, and I read about this, the real thing is that in the Obamacare, there's actually something that says coverage of illegal aliens or illegal migrants or undocumented migrants. And what the Democrats are saying is, no, we're not covering illegal aliens. We're only asking to cover DACA, asylum seekers, and refugees. The problem with that is literally everybody that came across the border under Biden fell into one of those categories, mainly the last two. Mm-hmm. Anybody that they released in the country, the only way they released them was by saying, oh, they have an asylum claim or, oh, they have a refugee claim.
Right.
Anybody who didn't have either one of those, they actually turned them around and sent them back. Very few. So there's 11 to 20 million people in here that are classified as asylum or refugee seekers. So they're covered. That's what the Democrats are trying to get covered.
All right, and listen, I got to take a break. Is that the end of your call, or do you have more? Because I got to take a break. And
other than I'm on Medicare, and if you get rid of Medicare, I'm going to have a tough time with paying bills.
This isn't even really a healthcare discussion. This is an economics discussion. The arguments that we're talking about here, they are usable in every industry, period. And look, that's why you have this guy, Bernie Sanders, universal health care should be a right.
I believe that the United States must join the rest of the industrialized world in guaranteeing health care to all people as a right.
Well, you can't guarantee something as a right if you have to take money from another person to make that right happen. Like, we have the right to own guns. Everyone agree we have the right to keep and bear arms? Does that mean I should be able to take money from other people and use it on me to buy me guns? No? Okay, so that's not what a right means, Bernie Sanders. Then you have one of the most Republican-y of Republicans, Marjorie Taylor Greene, coming out supporting the Obamacare subsidy extension.
And I'm not going to stand there and just keep talking the talking points when my own adult children can hardly afford health insurance premiums, when everyone in my district, it's the number one issue that I hear about day in and day out, not just people on the ACA, but people that have private insurance as well. And I think it's something that we have to talk about.
Is there no free market capitalist pigs left in America? Am I the last one? Me and Thomas Sowell and maybe 4 people on Fox Business? Are we the only ones? Because, look, I think at a bare minimum, we should repeal Obamacare. And if we can't do that, if we can't even make one step in the right direction, then it's a sad day. But I want to get rid of all the subsidies, all the programs, Medicare, Medicaid, but also all these regulations, all this oversight, all this paperwork, all these governing bodies, these boards. We have to get rid of all of that. Government intervening in healthcare has only served to make it worse. Look at all the interventions we have now. We have Medicare, we have Medicaid, we have the Affordable Care Act, we have Children's Health Insurance Program. All of these were sold to you promising healthcare would improve. It'd be more affordable, more accessible, even to the common people. Did it work? No. So at a bare minimum, can we start by repealing those? Because remember, every single regulation makes healthcare more expensive. Because if it made healthcare cheaper, we'd be doing it already. Companies would be doing it already. Consumers would be doing it already. You would be doing it already. But when I say every single regulation, I mean every single regulation. I mean even down to ending the licensing of doctors. James, you would end the licensing of doctors? I would end the government licensing of doctors. You would still go to medical school and you would be issued a degree. And if you went to the University of Texas Health School and they said, hey, we now award you the certification that you are a doctor. And you could hang that on your wall. Boom. That's cool. It's already illegal to lie about that. But I mean, in all these other little chintzy regulations, because once you get rid of just like the licensing part, then you would also get rid of all the things that say a licensed doctor has to oversee and sign off on any of these healthcare issues, whether you're going to get a prescription drug or whether you're going to get a scan or whether you're going to get some sort of treatment. A doctor has to sign off on that. Get rid of every prescription drug system, period. We don't need prescription drugs. Everything should just be over the counter, period, point blank, end of story. I would end FDA oversight, because built in the price of every drug is the hundreds of millions of dollars of FDA testing and approval process. You also have to pay for every pharmacist, every one of their bosses, every pharmacy benefit manager. Have you seen how much those people make? About $200,000 a year. Why? We get rid of every doctor that has to write the subscription if you got rid of it. Every office worker that has to file the insurance paperwork from the doctor's office. Every office worker that has to receive and process the paperwork at the insurance company. Every executive and middle manager at CVS and Walgreens and whatever pharmacy, Rite Aid, at every doctor's office, at every insurance company. All the advertising for it. All those costs are built into every pill. And you can't even imagine how much the cost of your drugs would go down if we took out all these costs that we're imposing on them. And you talk about how, well, I don't know if I could afford healthcare without all these subsidies. We can't afford it with all the subsidies. If you're on Medicare, it doesn't cover so much stuff. It doesn't cover like eye care. It doesn't cover hearing. It doesn't cover podiatry. And it's terribly ironic that most people don't need eye care or hearing care until they get past age 65. And so at the only phase of your life that most people are going to need it, it's still turned down. It's still the number one way you're going to be bankrupt in retirement is Medicare. But the question I get a lot, well, how are we going to pay for this if we get rid of Medicare and Medicaid? What did we do before LBJ? However we did it then, we already know we can do it. Churches are going to have to step up. Secular charity is going to have to step up. I don't know. We can have a chili cook-off. We can have a fundraiser. We can have a GoFundMe. But we can somehow still have like the St. Jude Hospital where a child with cancer whose parents can't afford treatment, they can go there and they can get free coverage. No one gets a bill, and it's the best coverage in the world. And we didn't have to steal $1 from a taxpayer to make that happen. Oh, we can do it. I just need y'all to be a little more imaginative. End all the subsidies. Just like regulations make the price go up, every subsidy makes the price go up. And that's, again, this isn't a healthcare argument. This is an economic argument. Because whether the subsidy is for the price of corn or college or healthcare, it is an economic law that if demand is static, but the money chasing the same goods or services increases, the price increases too. It's what basic inflation is when we print all this money for the deficit. That's why your prices go up. That's why your dollar buys less. You know, subsidies here, the Obamacare subsidies do not make healthcare costs go down. They just shift the burden to you, the taxpayer. So it's such a misnomer, misconception, just a miscarriage of economic justice that the conversation around this doesn't include repealing all of the things that have made healthcare so expensive in the first place. But let's get back to the callers. Y'all been really good here. Let's see what Ron in Garland has to say. What do you think about my idea of just repealing all of these subsidies? The Obamacare, Medicare, Medicaid, CHIP, get rid of all that. Get rid of licensing. Get rid of prescription drugs, everything over the counter. Go, Ron. What do you think?
First of all, good afternoon. How are you doing? Just real quick, man. That's all well and good if you've got a good plan to do it with, because like I told you, screener, I put 54 years into the Social Security. So am I going to get screwed out of my Social Security now?
No, I am.
Because they want to change
No, listen,
plans?
look, I have an answer for that. The Social Security Trust Fund is going to run dry around 2032. And so then they will only be able to pay out what can be covered by the money that's coming in, which will be estimated about 78, 77% in that first year. And it will dwindle every year since. So you're not going to be screwed by not getting Social Security. I know you say you paid into the system, but that's what everybody who paid into a Ponzi scheme says. Well, I paid into this. Now I should be able to get it out. But the money's not there. The bank vault has been robbed. And I didn't rob it. I'm just telling you the bank vault's empty. So no,
I know,
because that's not your money. Your money already got spent. And so when you get Social Security, it's not going to be your money. It's going to be younger people who are still working. You're going to be taking money from them. Now, just because you've been screwed for the last 54 years and people have taken your money and spent it on other people doesn't mean it's moral, ethical, or economically sound to continue the grift just until you pass away.
Well, yeah. So let's call Obamacare what it is. It's a distribution of wealth. That's what it was meant to be. And
agreed.
And we had decent health care before Obamacare. It wasn't the best, but it was decent.
But 80-something% of people in surveys said that they liked their health care system. Yeah, before Obamacare. You're right.
I know one thing. I had friends that were paying like $15,000 deductibles when Obamacare come around. So I don't think that's too good. But anyway, I understand the whole thing. The way the Social Security is being paid right now is the people that are still working right now. So I'm retired, but and I've got my retirements, and all that. I'm fine. But like I said, I'm getting Social Security because I worked for Social Security.
See, Ron, you shouldn't have told me you're retired, because that makes you even worse. Because your parents and grandparents left you a trust fund, and what people who are retired right now, I'm not trying to insult you. I'm trying. I want to tell you the truth, because you're not going to be looked at very well by subsequent generations if you don't do something about this. Because what happened is you took that trust fund that your grandparents and parents left for you, and you spent all of that on yourself. You took the money that you put into the trust fund and you spent it on yourself. And now you're taking money that we're putting in the trust fund and you're spending it on yourself. And if you're the guy that's in the Ponzi scheme taking money out on the day the Ponzi scheme collapses, which I think will be around 2032, you're the bad guy in this situation. Oh, I think you got plenty. I think you got way more than you paid in, probably at this point, depending on how long you've been retired. And you're the guy who spent down the trust fund that was already there. You're the guy who's not leaving a trust fund behind. And you're the guy who's taking more money out so the current generation can't put it into a trust fund. So, yeah, that's... I'm
all for any kind of plan, if it's going to be different and it's going to help people down the line.
Yeah, here's the plan. Cut it. End it. What's wrong with just ending it? How is that not a plan? Like when
What's your solution to do it? I understand exactly.
End it. That's my solution.
What's your solution?
When you cut out cancer, you don't replace it with anything. That is the solution. End it. What's the question here? Like, how are you supposed to survive?
No, I'm going to survive because, I'm going to work on my life. So there's a lot of people that didn't save. We did, So I understand, like I said, I had a stroke in 2016. That's why I had to retire. And people ask me, how did I get my disability so fast? So I said, well, I worked all my freaking life. How do you think I got it? I'm all for people getting Social Security. And if it isn't Social Security, if we can do something else, then that's fine. But you know it as well as I do. And Marjorie Taylor Greene, I think that woman's lost her freaking marbles. She all of a sudden she's coming up with all these freaking harebrained schemes. I don't understand her points at all anymore. But,
not getting a subsidy. I don't see the concern here. Like, what are you concerned about? What's wrong with just getting rid of Social Security? Because look, we're not going to let people die. We're not going to let them just.
I'm not concerned.
Okay, I know not you, but you're concerned about other people who aren't in your situation, I suppose. Because listen, I understand that a lot of people cannot maintain their current standard of living in retirement if we get rid of Social Security. But all you're going to do is do what we did for every generation up until a few years ago. You'll probably move in with your kids, or if your kids move in with you, and then you'll continue living in that house. And that would be a good thing. I think that would strengthen the family. I think putting off taking care of your parents, because that's who's really getting the benefit here from Social Security, isn't the people in retirement. It's for the children of retirees who don't have to take care of their parents like every other generation did. But think about it. It was so normal that if you go look in the census countings of your own family, how many people lived in the household, a lot of times it was kids, parents, and grandparents. There might be a couple aunts and uncles or a great aunt or uncle. But I think America would benefit if the grandparents had to move back in a lot of these households. Do you think we would have the problem with the letter people that we have now if grandpa was in the home? Do you think there would be a lot of gender confusion if grandpa was there saying, no, you're not a girl, you stop that silliness? There would be people to pass on the traditional values. There would be people to counteract the programming that they're getting from Netflix and public school teachers who are trying to groom them and the librarians who are trying to show them obscene sexual material. I think this would be a bulwark both culturally and economically, and I'm tired of pretending like it's not. The party continues. All right. Can we get a ninth day? Looks like we're going to get a ninth day. Can we get a 10th day? Can we get a 10? And got to get 10. And can I get an 11? Can I get a 12? Can I get a 12? We got 12 over there. Can I get a 13? Wow, this thing just keeps going on. Because every day that this government stays shut down, the American people can look around and be like, all right, I'm fine. What do we need to spend all this money for again? You don't. And that includes the issue that is holding everything up. It's all about these Obamacare subsidies. And look, I expect the Democrats, they always want to grow government. They always want to give away your money. I get it. But we have Marjorie Taylor Greene breaking ranks with the Republicans and wanting to extend the subsidies. And it's just, excuse me, Marjorie, I'm not done. It's just a display of pure economic ignorance that I don't expect this from Team Red, but here we are.
And I'm not going to stand there and just keep talking the talking points when my own adult children can hardly afford health insurance premiums, when everyone in my district, it's the number one issue that I hear about day in and day out, not just people on the ACA, but people that have private insurance as well. And I think it's something that we have to talk about.
I think the recent history has been crystal clear. The more regulations and money we throw at this problem, the worse it's gotten. And the first thing that we can do, the smartest thing we can do, is peel all that back. Peel back the regulations. Peel back all the subsidies. Peel back Medicare, Medicaid, children's health insurance, all that. All that. And you know what it is? Free market health care. From the political point of view, though, it should be called constitutional health care. Because the founding fathers knew about doctors and healthcare expenses and whatnot. And it's not like they're just sorry hacks that forgot to write that in the Constitution. No, it was explicitly left out that the government shouldn't be intervening into healthcare. And so if we just return back to what the Constitution says the federal government should do, then I would get my way. And I see both parties proposing things that are blatantly not just not working, they're also unconstitutional and they're economically illiterate. And that's where my frustration comes from. 800-288-9227. This is Kevin in North Richland Hills. You're on WBAP.
Hey, James. You went off the rails for a little bit there, but I think you're back on it. But the question I have, I'm 64. My dad's 90, and I live with him, okay? And we paid in to Medicare, Medicaid, FICA. It was all in your paycheck. I don't know if you get a paycheck and it's all in there, but we're on this edge, okay? And so if you cut all that stuff out right now, we're smoked.
No, you're not.
Okay. Give me your 2 points.
Okay, so for all of American history up until LBJ, somehow
Yes.
people who were your age and your father's age, they didn't have the same access to healthcare subsidies that we have now. How did they do it?
Well, they paid cash. And
yes.
I paid cash. I'm for I've had 4 cancer surgeries, and I paid cash for it all. Okay.
Wow.
But yeah. But beside the point. But all the money that we paid in for this, I paid in for this since I was 16 years old until I retired.
Yeah, well, that doesn't change the fact that it's gone now. You, when you say you paid into this system, you act like you paid into this money and they're just holding on to that for a future date so they can return this money to you. But you know that's not what happened, right?
No, they stole it.
Cool. All right, good. I like that verbiage a lot better. So just because someone stole money from you and gave it to someone else, whether it's for benevolent causes or not, we can kind of agree that there's, for a lot of people, they see that as unethical, myself included. You just want to continue the unethical practice when it benefits you. No. Okay. I just, we paid all this money into it, and we would like to get a return. Now from the guy that called that is on a trust fund, okay, because I don't make a whole lot of money on my pension, and you don't have a pension, but on your paycheck, do you still pay into that? What, FICA?
Medicare, Medicaid?
Yeah, I do.
Medicare and FICA. Okay, yeah. All right. Because I worked for a major airline, and this guy came up to me, and he said, young guy, and he said, what's all this stuff? I said, well, the more you make, the more they take.
Yeah, up to a certain point, but let me give you a little more thoughtful answer, because I was just trying to continue the conversation with short answers there. Let's take your 90-year-old dad and you and your situation, and if we got rid of Medicare and Medicaid, if you have assets and you possibly could cover it, you would cover it that way. If you had family members with disposable income and they were generous enough to help you out, you could get help that way. If you had like a fundraiser or a GoFundMe and you got your immediate community to chip in, maybe they passed the plate for you at church, you could pay for it that way. You could get help from perfect strangers by going to the charity hospital system that was mostly underwritten by religious organizations, and that's you see the echoes of that in the names for so many of our hospitals. There's Presbyterian Hospital over off Walnut Hill. I was born at Mother Francis Hospital, an obvious religious connection to the Catholic Church there. And so there's also Shriners Hospitals, where the guys that drive the little go-karts and parades, they have all kinds of fundraisers. Yep. And they get care there. There's St. Jude Hospital, where any kid can go get cancer treatment there. And that's the thing is you're going to have to rely on private voluntary donations, and that's much more ethical and efficient, and there's accountability there, and you don't have to go through the ugly thing of the taxation that's disguised, the theft that's disguised as taxation, I should say. That's all I'm asking for. Instead of the money being forcibly taken from us and put into the healthcare system, we can cover the job quite nicely with private voluntary donations, and I know we can because we did it for all of American history up until the 60s. And so that's kind of what my answer would be.
It will have to wind down, okay? Wind down and not just cut it off completely. Like I told you, I'm 64, and I saw all this stuff before you were born. Mm-hmm. And and my dad lived through World War II. I lived through Korea and Vietnam. But anyway, that doesn't matter. It's just needs to wind down slowly. I'm not a Democrat by all means. Believe me, I'm a Trump supporter.
Well, look, I would prefer for it to just be ended at the end of the year. That's fine, and we'll just deal with the consequences as they may. There will be a short period of chaos, but we'll arise better on the other side. But if it can get me to my end goal of getting rid of all these programs, and you want to wind it down over 3 to 5 years, I would certainly sign up for that. I would certainly agree with that part of it. If that's what it takes to get us where I'm trying to go, okay, I'll be a little soft on that part.
And we ain't playing a football game, okay? The end goal. All right.
I hear you there. All right. Well, hey, great discussion here. See, we're having great conversations here that I am not hearing on TV. I don't hear these good discussions in Congress when they're talking about this. This is the kind of stuff Marjorie Taylor Greene should be talking about. This is the kind of stuff that people should be saying back when Bernie Sanders says his goofy thing like, everyone should have health care as a universal right. We're the only country in the industrialized world that doesn't do it. It just sounds silliness. It's like economic elementary school. It's like I'm dealing with the kids' placemat at Shoney's. It's like, hey, we need to have more adult, grown-up, complex conversations about it. And you guys have done really good handling that on The James Show.
The James Show Podcast.